I'm Denise. I'll be your nurse today. Can you tell me your name?
I'm Tyler.
And how old are you, Tyler?
15.
All right, excellent. Well, today you're in for a cardiac assessment. I'm going to be listening to the same spot several different times, but it doesn't mean that anything's wrong, okay? Do you have any questions before we get started?
No,
okay, very good. All right, first of all, I'm going to start by looking at your carotid arteries, which are in your neck. I'm just inspecting them. I'm going to palpate them one at a time just to make sure that there isn't any problems. We never want to cut the blood supply to the brain. All right, now I'm going to go in and listen to them. I'm going to be listening with the smaller part of my stethoscope, which is called the bell, okay? And what I'm going to need you to do is take a big deep breath for me, blow it out, and then hold it. Good. Okay, you can breathe. And let's do the other side. Deep breath, blow it out, and hold it for me. Excellent. Okay, now we're going to move down to listening to your heart. I'm going to be naming each valve for you as we go, okay? So the first thing we're going to do is going to do the second intercostal space on the right side for your aortic. Then we're going to go straight across, second intercostal space left side for your pulmonic. Third intercostal space, left sternal border for your Erb's point. Goes down left sternal border, fourth intercostal space for the tricuspid, and midclavicular line for your mitral. Okay, we're going to just keep redoing those names for you. Now I'm going to listen with my bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay? All right, now I need you to lay down for me. Good. All right, first of all, I'm going to be looking at your jugular vein distension. Turn your head this way. Excellent. Okay, look toward me now. Okay, no jugular vein distension noted at this point. Now you can look straight again. I'm just going to inspect your pericardium, which is what is around your heart, for any irritation. Okay, now I'm going to palpate those valves. The aortic, the pulmonic, Erb's point, tricuspid, and mitral. You need tenderness when I push. All right, I'm also going to palpate for your apical pulse, which is right here at your mitral valve. Now we're going to be listening to those areas. Same thing as we did last time. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Now with my bell. Aortic, tricuspid, Erb's point. I'm sorry, aortic, pulmonic, Erb's point, tricuspid, and mitral. And can you roll to your left side for me? Excellent. Very good. Okay, roll back for me. Great. Okay, that concludes your cardiac assessment, Tyler. Okay, I'm going to give a report on a 15-year-old male who came in just for a cardiac assessment. We started off with his carotid arteries. To inspection, there was no pulsations or thrills noted. We listened to each of the areas of his carotid artery without thrills or murmurs noted. Also, there was negative tenderness to palpation and was able to palpate each of the areas of the carotid artery. Then we moved down to listening to his aortic, his pulmonic, Erb's point, tricuspid, and mitral, sitting and lying without any thrills, without any murmurs noted. Also, there was negative to jugular vein distension, negative to any irritation noted to the pericardium. Upon palpation of all 5 areas of the heart valves, no pulsations felt and no tenderness noted. Apical pulse was palpated at the 5th intercostal space, left side, right at the mitral area, and the left lateral was also listened to. All heart sounds were done with the bell and the diaphragm. Not only that, S1, S2 were noted, no S3, S4, no murmurs or thrills noted.